So if a patient goes to, they already have dentures. What are their options in your practice?
Okay, so we've got quite a few, but typically where we go from denture wear is, we can add a couple implants, 2 implants, and do what we call a snap-on denture, right?
Okay.
So what that allows them to do is get rid of the adhesive, and you don't have this hockey puck situation where it's just sliding around and moving. It has something that they can actually retain to. Next from there, if we add a couple more implants, then we get more stability. Still snap-on, still something that they can take in and out, but instead of maybe lifting in the back with only 2 implants, if we get 4 back there, it's stable like a table. But again, it's still a denture, so it covers a little more surface area than like a bridge or anything like that would, but it's not moving. From that point, then that's where we really get to the creme de la creme. Right?
Okay.
That's, same number of implants, maybe 4 implants. Sometimes we may go up to 6. But at that point, what we can do is we can eliminate the whole removable aspect of it. It's an implant bridge.
So you get like a full arch of teeth.
Full set of
that
teeth.
don't come out.
Molar to molar. And the beauty of it is you don't have this bulk of material in your mouth. So it doesn't cover the palate. And, a lot of people don't realize, but a lot of your taste sensation comes from the palate. And so when you have
like with these type of teeth, unlike a denture, you could remove the palate.
Remove the palate completely. It's a bridge, and it's only supported by the implant, so we don't need all that other surface area to cover in order to help balance and keep it in place. And they can eat what they want. They can bite into a corn on the cob or eat steak, and nothing is moving. It's not.
So
coming in
anything
and
you
out.
could eat with good, healthy, strong teeth, you could eat with this.
Absolutely. And the best part about it with implants is, a lot of times with denture wearers that we explain is a denture, it can give you a nice set of teeth that you can look at and kind of function with, kind of eat with, but all the while you're losing bone over those years. So you have to keep adding material to the denture just to get
expensive.
it to fit. Yeah.
Good point, interesting.
And they just keep adding that adhesive and gluing it on, but they're running out of bone, they're losing bone. When we place implants across the arch and you're chewing on those implants, and that maintains that bone really for the rest of your life.
Your face also doesn't sink in.
Yeah, so you don't get the wrinkles, you don't, you still have that, you don't get that sunken in face look that you would if you're wearing dentures.
And they could just chew. Do you hear eating stories all the time?
Oh, yeah. Again, those are the text messages and the emails that we get is I can finally enjoy a steak, or I can't wait because I can eat a burger.
Like salads too. Like broccoli or al dente pasta
Just any
or whatever.
food that's not liquid, really.
How old can you be to do this? Like the oldest for implants?
No limit. You could be 99 and still get implants.
What's your oldest patient?
92, I think, is the oldest that I've had with implants.
You were a little scared, probably.
I looked at that 92-year-old, and she was probably in better shape than a lot of 60-year-olds. So I wasn't too worried.
And worked out well?
Worked out well, and she's eating and loving life and enjoying, her later.
So a 92-year-old can do it. Somebody 75 that says they're too old, it's just not.
Absolutely. 75 is young.